specifically target support fathers and their communication with their teens. So I'm going to show you a few slides real quick, and then I'll give you a minute to ask questions or make comments if you have them. Okay, one moment. Okay, great. So I'm part of a team at Wellesley Centers for Women at Wellesley College, who does a lot around looking at how families can support adolescents' health and development. This project, we have a grant from the National Institutes of Health. Again, we're collaborating with Alameda Father Corps on this project to reach out to talk with fathers, and particularly fathers of colors and their families, to understand what's happening in their families with conversations about things like dating, sex, and relationships. We know that these conversations that fathers have with their teens can really make a difference in teens' health, but a lot of times those conversations aren't happening. And a lot of programs are really focused on moms, and particularly on white moms, and miss a chance to collaborate with fathers to support these conversations. So that's really the goal of our work. We're going to be doing phone interviews over Zoom with about 40 fathers. And we're also looking for inviting some of their families to participate. These are fathers who have high school age teens. They don't have to live with their teens. They don't have to be the biological fathers of their teens. And they don't have to talk with their teens about sex and relationships. So it's pretty open. Just the age group is fixed. And we want to understand from them what kind of conversations are happening in your family, what conversations aren't happening, what gets in the way, what kind of supports might you want to have these conversations. So we've started interviewing already, and Verve is going to send you some flyers that you can pass out, that you can share with really anyone in your networks. We would really, really appreciate it. You can pass on to people at work if you know people in your lives who might be interested, fathers who have this high school age teens. That would be awesome. And at the end of the study, we're hoping to come back and share with you what we've learned, and also get your feedback around how to share some of these findings with communities that you work with. So again, real quick, who can participate? Fathers with high school age teens in their lives. They don't need to have legal custody. They don't need to live with the teen. They don't need to talk with the teen about sex and relationships. We can do interviews in English and Spanish. They'll be about an hour over the phone. Every father and every family member who participates will get a $50 gift card for being part of the project. And if a father says, yes, they want to participate, we'll invite their, if they have a partner and if they have the high school age teen, to participate as well. We won't be sharing anything that they say in the interview with their family or with anyone else, unless there's a risk to their safety. So we're asking you please to spread the word. You may know this already. It's hard to get families to engage in this stuff. And a lot of times, again, it's the moms and it's the white moms who we hear from, but we're not hearing from fathers. We're not hearing from fathers of color. So it would be awesome if you would share this flyer with colleagues, with people you know, with fathers or people who know of fathers of high school teens. This is what the flyers look like. There's one in English and one in Spanish. And again, Verve will share them with you. I'm going to put my email in the chat, and I'm going to come off of this. Kevin, do we have like a minute for questions, or are we out of time?
Sure. Absolutely. Okay. I have a quick question.
Any questions or comments? I'd also, I put my email in the chat. So if you have anything you want to ask outside the meeting, I'm glad to give you more information, answer questions, or hear your thoughts.
How long are the interviews, Jenny?
They tend to be about an hour. With the dads and so far we've had some moms, and they've run right about an hour. The teen ones run a little shorter. You can see they might not be as enthusiastic to have these conversations with us.
And do you have these conversations with the teen while the parent is present, or separate?
No, we don't. I mean, we do get parent consent and teen assent to join the project and to have the conversation, but we really encourage them to look for a private space to be able to have a little bit of their own space to kind of give their own perspectives.
Okay.
Thanks.
Any other questions from the audience?
I have one.
Yeah.
On the info sheet, it said $50 gift card for each participant. And does that include the team? Because I can
Yes.
see that being an incentive.
Yes. So the father, in order for the family to participate, the father needs to participate. So they're kind of our initial starting place. So if the father says yes and participates, yes, we'll give the father a gift card. If the team participates, they'll get a $50 gift card. And if a second parent participates, they'll also. Yeah, good question. And we give them a few options of gift cards to find something that fits with their community, what's accessible to them.
Julie has a question.
Yeah.
Would it, instead of, because we have a lot of fathers in our both of our fatherhood and our parent education program, about 49% are fathers and probably more than half have teens. Yeah. And I was wondering, would it be okay to refer as an agency? Because our fathers tend to participate more when we refer over as a group and we help them navigate that process. You know what I mean? Like if I was to say, okay, guys, this is going to be happening. How many of you guys want to participate? We'll help you do that process, especially our Spanish speaking.
That would be wonderful. Okay. And you know, if you want, so my email's in here, if you want to kind of talk through how we can best support that process, that would be amazing.
Okay, that's good. And I will say that it usually works best. We get a lot of participation when we do it that way. And then the person we refer them to calls them to remind them and say, hey guys, you know, you've been referred over, and it just seems to get better retention.
Yeah, we'll work with you for whatever you think would help this to happen. And thank you for offering that opportunity.
Okay, thank you.
We got time for one more question if anybody has one. Seeing none. Julie, thanks for that question. Jenny.
Thanks to all of you. Thanks for the work you do, and best wishes. Thanks, Kevin.
Okay, I'll see you tomorrow, Jenny.
Okay, take care.
All right. With that, I am going to turn it over to Dr. Outlaw. Jason has been he's trained for the Fathers Corps a few times over the last several years. And he's back again to talk about mental health awareness and understanding ACEs. We felt like this subject was important because some of the dads that are going to be coming through and participating in your groups may be experiencing mental health issues, or you guys may want to have some conversations about dads paying attention to their mental wellness. And so Jason is here to help us figure out how to have that discussion with a group of dads. So without any more of my talking, I'm going to turn it over to Dr. Outlaw.
All right. Excuse me. Thanks, Kevin. I'd like to first thank First Five, Fathers Corps, Alameda County, and all the moving parts for putting this together. I think having these sorts of conversations is always important. Let me just briefly talk a little bit about my background to give some foundation here. So I'm a psychologist, born and raised in Oakland, California. And I am very much invested in speaking about mental health, reducing stigma, providing information, answering questions, whatever I can do to ultimately kind of expand and make a more robust understanding of kind of mental health issues. That's kind of what my purpose is. I do have a clinic in San Leandro, outpatient clinic. We serve the community, all sorts of different presenting concerns. And it's not just, when people think of psychotherapists, they think of severe sort of inpatient cases. I work with people who look like all of us. It could be family related sorts of stuff. It could be relationship stuff. It could be work related stress. It can be all those pieces. So I like to consider myself to be able to connect with people who look like you and I on these levels. All right. Before I begin, I did want to start and kind of have a really cool background. I saw Kevin and Dara's background. And so my background is the chair. I want you to consider it to be a hat. It's not like a high chair. It's some great sort of making too much of myself. I want you to see it as a hat. And it's my therapy hat and kind of sit in the chair. You can kind of see what that analogy is. I wanted to clear that up before we started here today. All right. So today we're going to be talking about trauma. We're also going to be talking about how to have conversations, like those tough conversations. And when Kevin and Dara approached me about this, I figured that we all have conversations with our loved ones and people who we work with. We all have conversations that at times we feel comfortable with. We have conversations at times where we don't feel comfortable. And particularly if we're talking about some presentation that maybe we're not as familiar with, it's going to kind of increase your anxiety and make you feel as if you don't have the tools to be able to be your effective self in that, whether it's you as a provider or you as a parent or a friend or what have you. And so I think the gist of today's conversation is really trying to increase the comfort level when you have conversations with people who may present with a sort of sensitive topic area, whether that's trauma or something else. So just briefly, let me give you the learning objectives for today. Increase understanding of trauma, including related symptoms and conditions. Objective 2 is increase understanding of our thoughts and behavior, manifestations of trauma. Objective number 3 is increase and develop listening skills around sensitive topics. And that's really the gist of it, right? So if you guys can walk away and you feel like, all right, the next time someone comes to me and they're in a really difficult, precarious situation, do you feel more equipped? That's kind of my major sort of objective there. And then last but not least is to be able to differentiate when further resources are necessary for those experiencing or who have experienced trauma. So bear with me on this piece. I'm going to give you guys some basic information about trauma. For some, this may not be anything new at all. And for others, it may paint a better picture of really kind of what it is. But what is trauma? To ask that question to begin with. Trauma is basically just an emotional response to a direct or vicariously, a vicarious sort of situation in which a significantly stressful event, right? It can include life or death or serious injury, but it doesn't have to. It can be something as simple as witnessing someone get into a car accident, or it could be experiencing that car accident for yourself. Of course, it does include things such as death and serious sort of injury. Most people would agree that if you witness someone being injured to a point where, you know, a particular limb may have to be amputated or whatnot, like we as human beings just don't walk away from that and feel as if we can kind of go on with our day. And I want to just say this as well, is for us to have an significant emotional impact based on us experiencing or witnessing a traumatic event, that's showing your human side, right? Like no one is expecting us to walk away and be strong. And if you were only stronger, then you wouldn't experience this. We're human beings and we all experience things within ourselves, and we have our emotional response to traumas, for example, means that your body is working the way it's supposed to work, right? We have anxiety, we have sadness, we have depression, we have anger, we have all these emotions for a reason. And if we weren't human, we wouldn't experience those. And oddly enough, other mammals experience some emotion as well. If you have a dog, for example, you clearly can see that your dog is excited when you come home, or most dogs are. No, not all are, but certainly you can see some basic emotion as well. So it is very subjective, meaning what is traumatic for one person may not be traumatic for another. And the piece that I want to share about with this is that humans are humans, and some people try and some people are better at masking their emotional response than other people. So here's an example. Let's say that you're in a quote unquote inner city part of town and you witness somebody shooting at someone else, and it's very clear that this person got hit. How many people are likely to be impacted by that, right? Like if we took 100 people, how many people are likely to be impacted by that? Not that I have an exact number to share with you, but I do think that most of us are going to have a fear-like response, whether that fear-like response is based on us hoping that the individual survived. Does this person have kids and a family? Maybe that could have been me. There's all sorts of cognitive or thought sort of processes that go on in your head that are likely to result in you having a significant emotional response to it. Now, that response might be for a day, it might be for a week, or it might be something that requires further sort of treatment and attention to it. But nonetheless, we do deal with things a little bit differently. And there are people who could witness a cold-blooded murder directly in front of them and they may go on about their business and go on with their day, right? Now, that doesn't mean that that person wasn't emotionally impacted by it. In my personal opinion, as well as my clinical opinion, that would mean that this person has kind of hardened themselves up to the reality of their environment, and they may be able to mask it better than the average person. Now, in their relationships, in their intimate relationships, in their family and friends relationships, will that manifest it, will that trauma and the effect of that trauma manifests itself in other ways? Very likely so, right? So it may on the surface not look like this person has a big impact, but they're very likely to manifest, or the symptoms are likely to manifest themselves in other ways, right? So it's subjective, and it can certainly be, experienced different from different people. Let me give you some of the common sort of traumatic sort of events that we experience as human beings. And these are the most common ones. This isn't a comprehensive list, but rape, assault, war, murder, sex trafficking, kidnapping, hostage situations, disasters such as Hurricane Katrina, both vicariously and directly experiencing that, as well as just kind of accidents. And that accident phrase is used very broadly. These are like common ones. Doesn't mean that if it's not those things that you won't experience a trauma-like response, but those are the most common sorts of areas with respect to trauma. Likely responses, and I'm going to talk a lot more about kind of symptoms in a bit, but the likely sort of trauma-like responses are a fear-based response, right? Not a complete surprise to hear that, but let me give you like a quick analogy. So we've all at some point in time kind of witnessed like a dog. I'm using dog examples today for some reason, but we've witnessed like a dog that has just given up on life. You can tell that this dog doesn't know where it's going to find its next meal. It's lost. It's not going to try at all anymore. It's just kind of look like it's ready to die. So very likely, if you approach that dog, you're likely to see it have a fear-like response. It's not going to be receptive to you petting it or doing something with it. It's going to have that fear-like response. And we as human beings can have that same experience or that same response based on what we've experienced in life as well. Some of us have singular sorts of traumatic experience. Some of us have complex and multiple trauma-like experiences. And in the human being, it's not going to necessarily look like a dog, the dog example that I gave, but it can certainly look like isolation and kind of a bit of a depressive sort of state. It can also look like anger and a complete version of, being mad at the world. So don't expect it to always look like what you may see in a movie or what you may think is the case. It can look and manifest itself very differently in different people, right? Okay. I have a question for you all, and I want to allow you to type this in the chat box, or if you do decide you want to unmute yourself, that's fine. But here's the question. What other mental disorders or problem areas would you predict someone with a trauma history to also experience? I'll repeat it one more time. What other mental disorders or problem areas would you predict someone with a trauma-like history to also experience? What do you think? Drug or alcohol abuse. Okay, certainly. Substance abuse is a very common one. Anxiety, sleep disorder, depression, PTSD. So I'm using the anger. Yes, all these pieces are certainly, we call it eating disorder, right? We call this comorbidity, and comorbidity is just a fancy way of saying we got some other stuff that's also going to be going on along the way, right? And so the most common sort of comorbidity issues are depression, anxiety, and substance abuse, which you all tackled really well there. Okay. Risk factors. What sorts of things put us at risk for developing a PTSD or a trauma-like sort of disorder? Childhood emotional problems, right? So if in your environment kind of growing up, you had to deal with a lot of, let's just say people put you to the tests, and there was assaults and there were just different fights and things going on, that environmental sort of factor certainly plays itself in. Let's also say that as a child, you had your own individualized sorts of concerns as well, whether that's like a blanking on the phrase here, but let's just say you had some behavioral sorts of problems, or you yourself had some substance use sort of experimentation going on as well. That obviously leads to other sorts of issues, right? So the environmental piece, childhood emotional problems, also the economic system of the environment that you grew up in, that also certainly plays a role into it as well. And this just makes it so that you are more at risk for developing longer term PTSD or trauma-like responses. Doesn't mean that you will. It means you're more susceptible to it. So I want to make that part very clear. There are certainly people who have resources and strong family values and people who are mentors and so forth and so on that kind of mitigate that, but it certainly can put you at risk. And that's not a comprehensive list as well, but those are the most common pieces. Okay, also lack of social support, family dysfunction, so kind of the opposite of what I just mentioned there a moment ago. Those are certainly reasons that the risk factors may actually develop into something more concrete. All right, let's talk about this. No, please.
Real quick, did you want to share your screen and share your slides?
It's probably going to confuse people more than anything.
Okay,
it's not really slides, just kind of what I'm looking at, the kind of as prompts here. But I do have a document I'll share a little bit later on.
No problem.
Okay. So what symptoms are related to trauma? I'm going to give you guys just a quick second just to think about this, because I do think it's important, instead of me just spitting information at you, that you can kind of test with yourself your own personal knowledge firsthand. So I want you to think about this just for a moment, but what symptoms would you say are related to a trauma-like sort of response? Just think about that for a couple seconds. Okay, I'm going to share with you, and these are direct symptoms based on the diagnosis of PTSD, which we all have a certain working knowledge of. So intrusive thoughts. What do we mean by intrusive thoughts? That just means that you are off trying to focus on your work or focusing on family or whatever the case may be. And now thoughts of that trauma are now finding themselves in your presence, right? So it might be a bit, and the related sort of symptom to this is flashbacks or dissociation, which we fancy word for saying flashbacks, but you're doing your own thing. And all of a sudden you're now focused on what that trauma was, and it's very much in the here and now for you, right? So those intrusive thoughts are very much a prerequisite to a true trauma-like disorder. Recurrent distressing dreams, right? Like, this isn't a surprise, but if you find yourself having dreams of the event and you find that that ultimately those dreams are distressing, they might be nightmarish, they might ultimately make you feel like when you wake up, oh my God, I'm so glad that that was a dream. That is a symptom of a trauma-like response. It doesn't mean just because you have a stressful dream that that is it, but that's certainly a symptom of it. Negative emotion, right? So depression, that's kind of the clear sort of example of negative emotion, as opposed to positive emotion, which is more of the, happy sort of optimistic sort of feelings as well. Sleep disturbances, that certainly is another one, whether it's hypersomnia, which means that you are sleeping too much, or insomnia, which means that you are not sleeping enough. Those are certainly symptoms, that's a symptom as well of a trauma-like response. What about a startle response? I kind of talked about, I gave the dog example, but back to that dog example, if you were to try to pet that dog and it cowers or it kind of backs up, that happens in humans as well. And it may not, clearly we're not petting each other, but someone may try to embrace you with a hug, and they're certainly not open to that. And that can be for a multitude of reasons, but certainly someone who has been through a trauma and maybe someone has attempted to take their life, for example, they're not going to be as open to the average person to embrace you with a hug, right? Irritability and anger. I definitely want to make sure that I'm clear on this, because a lot of people see someone who has been through a traumatic event as they should be socially withdrawn, and they should have that negative emotion and that depressive sort of presentation. And while that is certainly possible, In men, it looks like irritability and anger a lot more than it does in women, just kind of a gender difference there. But that doesn't mean in women, it can also look like irritability and anger as well. Okay. And so just this kind of general sort of reduction in positive emotion, I think is kind of a repeat, but it does make a lot of sense with respect to that. So all these symptoms, as we're seeing, are kind of indicators, right? I'm certainly not expecting anyone to be able to diagnose, and it's not kind of your role to be out there diagnosing. But I do think that it makes a lot of sense that we are able to recognize trauma and kind of what it looks like in many ways. And if you are able to recognize it when it comes a little bit later in our training today, it's going to be easier to kind of show that you have the ability to listen and be there for someone when you kind of understand the basic sort of tenets of it. So once again, for a lot of people, I'm sure that was a repeat, not anything completely brand new, but hopefully you learned something from that part. Okay. We're going to transition over. I have a quick activity that I want to do with you guys. And this is in the early stages of our discussion here, but I talked about symptoms a moment ago. I talked about kind of what trauma really is. And that, of course, does qualify as kind of a sensitive topic to discuss with someone. But I just hinted upon how it may manifest itself, right? And so there's two kind of major categories of how a trauma may manifest itself in an individual. On the cognitive level, and when I say cognitive, all I really mean is in your thoughts. Are you having strong sort of negativistic, catastrophic thinking that occupies you and inundates your time and doesn't allow you to focus on things? That's an example of a cognitive thought or a cognition or a thought. And then on a behavioral level, what are we doing behaviorally as a result of it? So if you drive down the street and someone happens to get in your way and, it's kind of almost an accident, and you honk your horn and hold that horn for 15 seconds and flip them off, right? Like that's a behavioral manifestation of a response to something. I'm not saying that, just because you have trauma that you're going to do that, but I want to be able to separate the two. So cognition, a thought, kind of what's going on in your mind, your conscience, and a behavior is a behavior, right? So what are you actually doing, in terms of action? So what I want us to do right now, I'm going to give you guys a moment. We're going to break off in two different break-off rooms, right? And so we're going to take just 5 minutes. And this is, once again, my attempt at not just lecturing at you guys for a whole hour, but I want group number one, which is going to be the cognitive room. I want you guys to identify and come up with the cognitive manifestations of a trauma, right? So cognitively or thought-wise, what is likely to be the outcome, or how might we see it manifest itself in someone who has experienced a trauma? And then that's going to be the room that I'm going to manage. And then break off room number two, you all are going to have the behavioral manifestations of trauma. So in other words, what can people do that might give you a hint or indication that, all right, this person may have been through something that may qualify as a response to trauma. So I'm going to let the techie people put us into the rooms, because I'm sure you guys know what you're doing.